Big Country Politics on KTAB continues.
Well, thank you for staying with us, and we are continuing our recap on our virtual town hall that we had last week with some of our city leaders and health officials concerning the coronavirus. Now, we highlighted some of the mayor's highlights during our last segment. We're going to continue our highlights here and hear from the city's response.
Well, I'd like to echo that. We are very appreciative of all of the collaboration that we have experienced from the healthcare community, from the different organizations in the community, schools. It's really been remarkable to see how much everybody is working together. They are giving sacrificially of their time, their efforts. Staff is working weekends and evenings, and I think that we all feel a little bit of angst, but when we all come together and we talk through problems, that really has just made such a big difference. And so at the health department particularly, we are very grateful for that and the support that the community has shown us.
That is the Director of Health Services, Alette Lerma. Why don't we go to Abilene City Manager Robert Hanna.
Sure. So I'm also talking to my peers in the Big Country. I've got a text message chain with about 7 or 8 different city managers in the region, and we're working hard to make sure we're all on the same page in our response, that we stay ahead of the curve, that we have an opportunity to make sure that our communities and our elected officials are informed of what's going on. And I think as we move forward through this pandemic, we'll be able to continue to communicate like that. I think that's really important to make sure what other cities are doing. I don't want to be necessarily behind what other communities are doing in our response. I also don't want to panic, and I want to make sure that we don't kill our local economy. You know, small business is the driver for us in many ways, and I want to make sure that the impact that's made upon small business is as minimal as possible while still protecting the public health. And it's a balancing act, and it's something that I think we've done for the most part well. Mayor Williams is correct. There are some things that if I go back in time I'd probably maybe do a little differently, but I don't think they were mistakes in the sense of you know, wonder blunders. I think they're just more strategic errors on our part, but you know, the first casualty of any war is a plan, so we adapt and overcome.
And I think this next question a lot of people are wanting to know, and this could be Annette or Robert Hanna, our city manager. This is, many are asking why tests were delayed and if the problem is unique to Abilene.
So I'm going to follow up a little bit with a shelter-in-place comment.
Okay,
I'll be happy
sure.
to answer that, because I have a different perspective on this, because I'm the guy that has to actually enforce whatever the mayor or the judge would decree from a shelter-in-place standpoint. It's not working in California. You can go on Facebook and you can go on other media outlets and you can see people are still going about their daily lives. So I think the mayor really hit on something. If you feel the need to shelter in place, shelter in place. If you're sick, stay home. If you're an employer and you have an employee who calls in and says, look, I'm not feeling well, give them the grace and the courtesy and the respect of the rest of your workforce. Let them stay home. We're going to be able to beat this thing and stay in front of the curve if we are proactive and we make those sorts of sacrifices and give our employees that type of grace. The other thing I'd say about the test results is that a couple things are going on. First, the state of Texas said they weren't ever going to, at the very beginning, they weren't going to release these numbers, okay? Partly because it's a fluid situation. They didn't fully understand if they were going to be able to have an accurate reporting, a number of reporting. We think our numbers are about as accurate as they can be, but it's relying upon the private practitioners in town to report to us whether or not they've administered these tests or called for these tests with the private clinics. So we are certain, one thing, that we're releasing them now. We'll continue to release them. They'll be updated on a daily basis at noon on our website. People can go to abilenetx.gov, and at the very top of the website there's a little red blinking light that says COVID-19 updates. You can click on that and get to this information. And the other thing I said, and I said this yesterday, I think, to another reporting agency, is that I want to be very sure that we don't make lepers of members in our community who may have this disease. It is not a death sentence, and it is not anything to cause a great deal of panic over. We want to make sure we suppress as much as we can the novel coronavirus, but at the same time, everybody panicking is probably the worst thing that can happen to us in response. Annette, I know this is something that you deal with on a regular basis, and you answered this question earlier. You may want to update some of that as well.
So I think very early on, we were trying to establish a new normal at the health department. We offer over 19 different services and programs, and trying to regroup your entire organization to do something different that no one has ever done before, it was important that we take time to educate ourselves, that we retrain staff to do a job that they've never done before. And so getting all of those processes in place and training staff appropriately, initially we weren't putting out a lot of information to the public, and it was really just because we needed time to regroup and organize within the health department. I think that is done. The staff has responded amazingly, and so we're ready to start sharing information with the community, educating more appropriately, and so we intend to do that moving forward.
Well, and I think with that line of answers, y'all have really answered the next few questions. And one of them was, you know, there are cities like Lubbock, San Angelo that are putting out the numbers daily. We're going to start doing that. Sure. It sounds like also you just answered why we waited to put out those numbers. You went through that. From Sam, how are we ensuring everyone, including low-income and uninsured people, can get tested and treated at no cost?
So there's a couple of different ways that testing can occur. There's testing that goes through a private laboratory, and there's testing that goes through the public health department. What we're encouraging citizens to do is to reach out initially to your primary health provider. They're going to ask you questions over the phone. They're going to determine your symptoms. They're going to look at your history of where you may have traveled. They're going to look at any underlying health concerns that you may have, and they're going to decide whether you're a candidate for testing or not. If you call the health department, we have nursing staff and medical providers that are going to do the same thing. They're going to go through that process. We are directing the uninsured to the health department, and we are directing the insured to your normal healthcare provider. So with insurance, you can get that done through regular insurance processes, and if they are tested through the health department and they meet that CDC criteria, then all of that is done for free and they don't pay.
And speaking of low cost and low income, what about Mayor or Mr. Hanna, what about water bills, utility bills? How is the city handling those things?
Well, and I also want to let Robert segue, is we want to be responsible. We want to assist our neighbors. We want them to pay the bill if they can. If there is a situation with their bill, I would direct them to have a conversation with city administration and allow them to work out something. We don't want, in the midst of trying to address the various associated with this crisis, to let a utility bill provide another additional obstacle.
I'd add that just as the mayor's indicated, and we've said in a previous press conference, we will provide grace to our customers. This is an exceptional time for our community and for our state and country, and the world really. And water is a basic need, and we're going to make sure our citizens have basic needs. If we have people who are abusing and take advantage of that grace, I will visit with them, and we will make whatever decisions appropriate. But if we have people that are in good faith in a difficult situation, we will provide all the grace necessary for them to continue to support their family with the basic needs of water.
Let's go to Annette Lerma.
Well, I think it's good to kind of recognize that we're each approaching this from a different perspective. I, of course, am approaching it from a public health standpoint, and the economic impact is certainly just as important as that, because it all leads to the vitality of an entire community. And so I think that just conveying that message that there is no cover-up of anything, that we're all sitting around the same table, we're all having those discussions, talking about it from a different perspective, but we do absolutely have the citizens' best interest at heart. We live in this community too. We want it to be healthy and also vital.
Director of Health Services, Annette Lerma. Next we go to Abilene City Manager Robert Hanna.
So I just want to reiterate the fact that the city is ready to serve. You know, during times of crisis like these, I think they can be defining moments for the community. You've got a council that is seriously committed to maintaining the public's health, safety, and welfare throughout this crisis, but also doing it and balancing it almost on a razor's edge of not having the cure be worse than the disease. And what I mean by that is simply making sure that we do our level best to keep the economic engines of our community thriving to the best that we can during what is going to be a downturn. There's no way around it. We're in the middle of one, and we're just going to have to make the best of it. I will also say that there are opportunities to give, be it through the Community Foundation or United Way or any other social agency for that matter. Abilene United, you can text Abilene United to 41-444, I think is the number. That's an opportunity to give. The mayor mentioned the Community Foundation. That's also an opportunity to give. There are other social agencies out there that can help. The bottom line is take care of each other, take care of your neighbor. Now's the time for all of us to come together as a community and to help each other through this. And your city is going to be an integral part of that, and we are here to serve.
Abilene City Manager Robert Hanna, thank you very much for being here.